So we always are looking at the body as a whole, even though we are focusing on L4, L5 herniation, and L5 and S1. That is our focus, but in order to get there, we are going to treat the whole body. And any improvement that we make is going to minimize the pressure and the stress on our body, giving her a better healing and a better result in the long run. So we always work evenly both sides of the body, and then we will focus on the area which is affected. And I also need to work on the opposite side for reference to what's happening on the left, in order for me to figure out the best way to balance her. We are finding on this side, although it is not as tight as on the left, in the same areas affected, she also has the very strong trigger points on the peroneus and on the tibialis. So I want to make sure I relieve those two on the right side. Also, this being her good leg now, she has come to rely on it much more when she's walking, because she's limping right now. So in order to get her through this, I want to make sure that the right leg stays in good shape and good condition, because she's going to be overusing it during this period of time. Now, I know from experience in working with many lower back herniations that we have a timeline here that we can expect. In the best cases, manually treating these conditions, we can expect there are at least 6 months of therapy, if not 9 months, before she will be ready for a normal rehabilitation with a physical therapist and going to the gym and yoga and other kinds of working out. At this stage, though, it's very important that she doesn't stretch or do any weights or any aggressive impact therapy. I have her now mostly exercising in the water or doing stretching very gently on her back in a safe position, not weight bearing where she can possibly do any damage to the low back. We put her in the water, which I like her to be in the water, just floating on her back every day for a half an hour to 1 hour, once or twice a day. This is because the water is the only place where we can get away from the gravity. And when a disc is herniated and the annulus bursts and spills out into the spinal cord, which is what it has done, into the foramen of the spine, until the body absorbs that and the swelling goes down, the spine is going to be very unstable. And the water is the safest environment because it takes the gravity off of the disc and also allows the disc to actually expand and allows it to heal best. So for the first couple months, when I have a client like this with a severe spinal injury, I do not want them doing any weight-bearing activity. The weight-bearing of just getting in and out of bed and standing around and sitting is oftentimes more than they can handle. So we certainly don't want them to do anything else until finally the herniation has healed and the pressure on the spinal cord has been relieved. Then once I feel that that has happened and I see the signs that she has recovered and that the disc has scarred up and healed, then we are ready to start doing the next phase of rehabilitation, which will be much more aggressive stretching and weight-bearing activity and strengthening. But until I find the low back is stable, we do not want to do that because we can actually cause serious damage to the spine and the nervous system when the spine is floating like that. Also, heat and ice have been very important for her, even more important than the anti-inflammatories, because the regular application of ice to the L4 and L5, bringing down the swelling on the nerve, and then the heat, actually not for L4 and L5, but for the muscle and tendon, in order to heat it up and soften it and improve circulation.